Hi everyone, I'm Dr. Sinukumar Bhaskaran and I'm a hip and knee surgeon at Manipal Hospital, Kharadi. Today I'm going to talk to you about a very important topic, that is arthritis. Now, arthritis is a disease of the elderly usually. And what happens in arthritis is the cartilage, which is the cushioning material in between your joints, wears out and you tend to develop pain and inflammation, swelling around the joints, and which is for what the patients usually visit us, and it's usually treated with medicines, physiotherapy, and in certain circumstances when the pain is not relieved, we have to consider surgical interventions as well. But is arthritis just a disease of the elderly? No, there are certain conditions in which we see arthritis coming up in very early stages, like in your early 20s, 30s as well. You could develop arthritic changes. And what are the causes for this? Number one is a cause called as inflammatory arthritis. Now, this is a wear and tear that happens because of certain changes that occur in the cartilage due to certain diseases like rheumatoid arthritis or ankylosing spondylitis, in which the disease process itself leads to damage of the cartilage and you can have wear and tear between the bones. Now, this is treated differently, treated with medications in the initial part, and it can definitely be well controlled if the patient meets a rheumatologist or an orthopedician at the early stage. So that's one cause, that is inflammatory arthritis. Second is if you have certain sporting injuries early in your life, like while playing you have a ligament injury, a meniscus injury, or a cartilage injury. This, if not treated in time, can manifest later on as arthritis. And the third cause is if you have certain alignment issues in your lower limbs, either a hip, knee, or the ankle. This could be either due to birth defects. You could have an abnormality in your thigh bone or your leg bone, which would lead to malalignment, and as a result you can have exceeding loads placed on one side of your joint as compared to the other, and this can also lead to arthritis very early. And the same malalignment can also occur due to certain injuries of the bone, certain fractures which have united or which have healed in a wrong position, and this can again place abnormal loads across your joints and lead to early development of arthritis. So in a nutshell, one can develop early arthritis if you have inflammatory arthritis, if you have post-traumatic, that is injury related arthritis, and thirdly, if your limb alignment is not normal, which is called as malalignment, then you can develop arthritis much earlier, not in the ages after 50 or 60. You can develop it in an earlier stage. Thank you.